Okay, hello, welcome everybody. Um, my name is Molly and I am the publications officer for the BPSA, and I'm also the co-host of this webinar. Uh, Sanjita, if you'd like to introduce yourself.
Hi, I'm Sanjida. I'm the Southern Area Coordinator and I'm the co-host of this webinar.
Okay, amazing. Just bear with me one second whilst I share my screen. Hey, hello everybody. Welcome to this webinar. As I've already said, I'm the co-host. My name is Molly. I'm the publications officer for the BPSA, and I'd like to give everyone a very warm welcome to this webinar entitled Disability and Pharmacy: Real-World Perspectives from Patients and Professionals. And we're running this webinar in celebration of Disability History Month 2024, which is one of the campaigns that is run by the BPSA on a yearly basis. So before we get into the speakers, we're just going to start with a quick icebreaker sessions, which is going to be run by Sanjita. And we're going to quiz everyone basically on some common myths that you might come across when you're thinking about disability. So if you'd like to go to the first question, Sanjita. Okay, so can everyone see this on their screen? Just give me a nod. Perfect. So question one, 10% of the world's population are estimated to experience a disability. Is this true or is this false? You can cast your votes now.
I'm going to give it a few more seconds before I end it. So, it's actually false. It's because it's estimated that 1.3 billion people experience significant disability worldwide. So there is at least 16% of the world population, 1 in 6 of us. Next question. In order to diagnose ADHD, patient needs to display a minimum of 6 symptoms. True or false? Few more seconds. The answer is actually false. So, oh, yes. So in children, patients must display minimum symptoms of 6 for diagnosis, whereas in adults, so adolescents over the age of 17 and over, only needs to present with 5 symptoms for the diagnosis to happen. People with visible disabilities have enhanced hearing compared to sighted people. True or false? So the answer is actually false. Well, people becomes more used to sounds and may develop stronger auditory skills over time. The ability is generally not physically enhanced. Um, Children can outgrow dyslexia. True or false? Okay, so that is false indeed. Dyslexia does not go away over time. People with disabilities are at greater risk of developing serious health condition than people without disability. True or false? Okay. So it is true. People with disability have twice the risk of developing health conditions such as depression, asthma, diabetes, or even strokes. The term blind means someone that cannot see anything at all. True or false? Okay. Um, so the answer is false. It is believed that around 93% of people who have visual impairment still have some useful vision. Oh, sorry, I haven't shared the results. Okay. Autistic people are antisocial. True or false? Okay. So it is actually false. Most autistic people enjoy having relationships. Autistic people may sometimes struggle to understand certain social cues, such as a nonverbal communication, tone of voice, sarcasm, and body language. But these are some challenges that makes it difficult for them to build a relationship, but that does not mean they're antisocial. Only boys have ADHD. True or false? Few more seconds. And I'm going to stop. That is false, but boys are twice as most likely to be diagnosed than girls with ADHD, but that does not mean the girls don't have it. Part of the reason is that girls are less likely to cause trouble with hyperactivity and control compared to boys. ADHD is not a learning disability. True or false? So that is true. ADHD symptoms can get in the way of learning, but it is not a learning disability. They do not cause difficulty in learning specific skills such as reading and writing. Last question. So the majority of people with vision impairment are over the age of 50, although vision loss can occur at any age. True or false? Okay. So it is true. Visual impairment is more common in older adults, but it can still affect people of all ages, including children. This comes to the end of our poll, and we'll move on to our speakers next.
Okay, thank you so much for getting involved with that, guys. I hope that you've learned something new, and we've maybe managed to debunk a myth that you might have thought was previously true. So we're going to move on now, and we're going to introduce all of our speakers. They're going to give a short introduction to themselves, and then we're going to move on to a panel discussion. So we'll start with the first speaker, Anna. If you'd like to introduce yourself.
Hello, my name is Anna. I'm just gonna share my slides. Can you just stop sharing, Molly, and then I can. Sorry.
Mhm.
Thank you. Can you guys see this? Oh,
Yeah, we can
am
see
I
it.
sharing?
Thank you.
Okay. So, hi everyone. As I said, my name is Anna, and I'm currently the European Pharmaceutical Students Association Officer for the BPSA. I'm a hospital-based trainee pharmacist, and I've graduated from Kiel, and I'm also an NHSE trainee representative. So my chronic pain journey began unexpectedly in March of my second year at university. For 2 years, I struggled to secure the adjustments I needed to work and learn comfortably. It was a long road, but advocated for myself, and finally obtaining these adjustments and accommodations truly changed my life, and my understanding of how critical empathy and advocacy are in healthcare as well. I still don't have an officially confirmed diagnosis. I've visited numerous clinics and undergone countless tests, all of which came back normal. Like many others in similar situations, I encountered a frustrating reality. Um, the lack of visibility in evidence often meant that my symptoms were dismissed or attributed to psychological causes. My GP, who has been my anchor through frequent changes in care providers, suggested fibromyalgia, and they tailored my treatment plan based on this assumption, which did bring noticeable improvements. However, the skepticism I faced wasn't just medical, it was societal too. Women, particularly those with invisible conditions, are often dismissed or misunderstood. I turned to CBT to manage health anxiety later on as well. That tool not only helped me navigate my own mental health, but it also made me aware of the systemic biases that can undermine patients. This experience has deeply influenced my approach to pharmacy. I learned the value of resilience and the power of advocacy, not only for myself, but also for the patients I now serve. It is a reminder that as pharmacists, we are often here to bridge between the patients and the healthcare system. And even small acts like truly listening to a patient or validating their concerns can make a profound difference. as a profession, we have this opportunity and a responsibility as well to foster inclusivity. By embracing these diverse experiences like mine and reflecting on the barriers that people with disabilities face every day, we can create a healthcare environment that doesn't just treat illnesses but also empowers individuals. Thank you for listening to my story. If you'd like to discuss this further or explore how we can make pharmacy more inclusive, please don't hesitate to contact me. These are my contact details, so my email and my LinkedIn. And I believe that together we can champion understanding and support within our profession. Thank you.
Thank you so much for that introduction, Anna. I'm just going to share my screen again. There we go. And I am now happy to introduce our second speaker, Naheem. If you'd like to introduce yourself.
Hi, everyone, and thank you for inviting me today. So I don't have any lived experiences. I'm not disabled, and but I just wanted to talk about some of the organizations that are there to support you, and discuss any issues that you have, whether it's help with these issues, both at home or at work or studying. So I've got 3 roles. I'm an academic pharmacist, hospital pharmacist, and a community pharmacist as well. And on top of this, I also do some volunteering work for pharmacist support. I'm also an RPS ambassador for the Northwest, and I'm also a regional committee member for the Pharmacist Defence Association, PDA. So basically, I was hoping to just talk a bit about each one of these organisations. So first of all, Pharmacist Support. It's a charity, independent charity, so anything you discuss will be kept confidential. It wouldn't be discussed with any other organisations, including the GPHC. And so what I like to think of the pharmacist support is essentially a charity for us, pharmacy students, trainees, pharmacists, retired pharmacists. I think it's quite great actually that there's a charity just for us, and it's basically there in times of need, support. So it could be an issue at home, it could be an issue at work. Basically, anytime you think you need help, contact the charity. Most people know of the charity of Listening Friends, so you can basically pick up a phone and speak to someone in confidence about any problem that you have, anything that's bothering you, and so on. There's also support in terms of counselling, well-being, coaching, and there's a lot of information online on their website as well. So essentially, it's there when you need it. And fingers crossed you won't need it, but there might be times where you will come across someone else who you think actually they could do with some support here. Maybe they're not doing so well. So the other organization I want to talk about is the RPS, the Royal Pharmaceutical Society. I'm sure everyone's heard about it, but what you might not know is that there is actually a particular group called the ABCD, Action in Belonging, Culture and Diversity. And essentially anyone who's got a protected characteristic. It's a group where they meet up on a regular basis, and it's a safe space to talk about any issues that you want to discuss and bring to a profession-wide level. If you want to go straight to the professional body and say, these are some of the issues that are affecting me, then you can discuss that with the professional body. It doesn't necessarily have to be in that meeting. You could also email or speak over the phone in confidence as well. Anything that you think actually is not, particularly working well, being a student, trainee, or pharmacist, or retired pharmacist, that you think actually, there needs to be some change. Um, I, membership is free for students. But what I would also say is the ABCD group, you don't have to be a member. So you can just attend anyway. But if you're a student, it's free membership. So why not? There's a lot of other resources that the RPS has to help students. And the next organisation I will talk about briefly is the PDA. And I mean, what I will say is very quickly is it's free for students to join up, and every member they give £1 to pharmacist support. So if you join, you're already contributing to the profession, and also they are the profession's union. So any workplace dispute that you have, that's what they're there for, to support you. Thank you very much, and I hope I didn't run over time there.
No, you didn't. Thank you so much for that. It's really useful for pharmacy students to understand that there are resources out there and people for them to go to. So thank you so much for highlighting that. I'd like to move on and introduce our third speaker now, Dominic.
Hi, everyone. My name's Dominic. Molly got me in as I think more as a patient user perspective with regard to pharmacies. I don't work in the pharmaceutical industry. I'm not a pharmacist or anything, but I am a 57-year-old man living with multiple sclerosis who uses pharmacies on a fairly regular basis. And I'm open to any questions. Thank you.
Thank you so much for that introduction. I'd like to now move on to introduce our final speaker. Kamal, if you'd like to introduce yourself.
Okay, so hi everyone. My name is Kamal. Thanks for inviting me to speak on this panel. So I'm actually somebody with a disability, similar to Anna. So I have been a pharmacist since 2016, 17 even, if I can get the dates right. But in the third year of my university, I actually lost my hearing in both of my ears. So I ended up going and taking a break. So I now wear hearing aids. And I'm here to kind of give you guys information about what is actually out there, what can support you from that journey of being in university. So you've got your Dean of Students available for you. And without them, I wouldn't have actually completed my degree. So any students there, make sure you utilize them. They offer lots of support. And then what you need to do when you get into the working world. So I've actually utilized pharmacist support in the past, which has been great. I've had the PDA be really supportive with me during my career when I was in hospital outpatient for Lloyd's Pharmacy. That was really helpful. But I now currently work in a clinical pharmacist role in GP practice. So I think I'm more of the living kind of example of it doesn't matter if you do have a disability, but you can still get there, and to understand what resources are out there and what support you need for things like access to work, workplace passports that are available as well. And I think the final point I want to say is that throughout the journey of anybody having disability, yes, it's very hard, but you learn transferable skills. So I can now relate to a lot of my patients and I can empathize with them more, understand what they are going through. And I'm also one of the members of the PDA Ability Network, which is available for anybody out there in pharmacy who has any form of disability that it's a safe space. Again, we discuss any sort of disability that anybody has, and recently we just launched a campaign which is called Standing Up for Sitting Down, so asking for reasonable adjustments in your workplace, which is becoming a lot more common out there. So yeah, there's lots of things that I can actually speak about in regard to my own personal journey, but I just thought it would be a good idea to just let you know what resources are actually available for you when you get out there into the working world, because that's a little bit different to what you get when you're at university. I'm here open to any questions as well. Thank you.
Hey, amazing. Thank you so much to all four of our speakers for introducing themselves. And thank you so much again for joining us today. So we're going to move on now to a panel discussion / Q&A. So I'm going to stop sharing my screen. If anybody has any questions that they would like to direct to any of us, any or all of our speakers, please put them in there's a Q&A function down at the bottom of the screen, which you'll be able to see if you just click on that. You'll be able just to pop your questions in. But I'd like to start with a question, if that's okay. Has anybody experienced, whether you've been working, as a trainee or a pharmacist, or whether you've experienced this in a healthcare setting, any stigmas associated with disability? I know we talked about stigmas before in the introduction. And has this affected you? How has this affected you? Has it made you learn anything?
So, I mean, I could answer that in the sense of, I think the stigma is based on your workplace setting, so who you're around. And it also comes from within. So it's how you perceive it as well. So it could be, for example, when I first got diagnosed with it, I couldn't really accept it. So it comes along the idea of accepting that you actually do have something that requires a reasonable adjustment. And then I have also had incidents, I suppose, maybe in work where I've felt maybe inferior, because I feel like, okay, maybe I'm not as, and that might be because of my disability. However, that didn't stop me. And I think that's the key thing to just remember and understand, that whatever condition we have, we all have different mental health conditions, and it can affect within any way. But there are organizations out there that are there to support you in your difficult times of need. And no matter where you want to get to, you can get there. It's just finding those resources that will help you to get there.
Amazing. Thank you so much for that. Does anybody else have anything else to say, or I can move on to the next question? No? Okay, amazing. I'll pass over to Sanjita then to ask our next question, sorry.
Okay, so someone asked, for anyone as future pharmacists, what can we do to make people with disabilities feel heard and seen? Should I repeat the question? Okay, for anyone as future pharmacists, what can we do to make people with disabilities feel heard or seen? Like, what can we do to make it easier for people with disability?
Can I answer
Can
this question? Do you want to go first, Dominic?
Okay. All I was going to say is, from a sort of user, patient, or whatever customer perspective, using a wheelchair, so often you go into a pharmacy, and often they've got a counter that's way up high, that's sort of aimed at, the idea is people walk in and they interact with the pharmacist or the assistant or whatever. You go in a wheelchair, and if it's a really high counter, often they don't see you, or you feel you have to just sort of wave at them to attract their attention. And I mean, that's a sort of simple chemist design thing, I suppose. If they were more at desk level, these counters, then we wouldn't feel so different, I suppose.
Thank you for sharing your experience. That is a great important thing as well. You're actually not the first one to mention this. I've heard from someone who's a wheelchair user. She had the same issue as well. So that is something that we really need to look into as well.
Mm. Mm.
Any of the other speakers, do you have any
Can I
advance?
add on?
Yeah.
So similar to what Dominic was saying, now working in a hospital and seeing patients in secondary care, it's asking them whether they can hear us, first of all, trying to help them adjust if they're comfortable before even starting the consultation, and asking them how they're feeling, if they're okay speaking now, if they're in any pain. So exploring those options first. Whether they're comfortable and if everything's okay for them as it is, so they can focus on answering us as well.
Anyone? Thank you, Anna. Anyone else?
Actually, I've got one more thing, if I may.
Good.
Recently, I visited a local pharmacy that I visit quite a lot to pick up prescriptions, and they suggested I signed up to some. It's like an automated collection service where you type a PIN number into a keypad and your prescription is dispensed out of a hole in the wall, sort of similar to an ATM or something. They said, "Would you like to sign up for that?" And I said, "Yeah, fine." And then, of course, I went out there, and the keypad and the slot are too high up to reach for someone in a wheelchair. So perhaps that's something that, for that pharmacy or that chain of pharmacies, perhaps that's something they didn't think about.
Yes, of course. I'm so sorry to hear that. Once again, it is something that we really need to look into, because wheelchair users need to have everything done accessible. Any of the others?
I mean, just going back to one of the questions earlier when you were saying about are people with disabilities more likely to get health conditions? So perhaps people with disabilities are more likely to have more prescriptions than people
Yeah,
without disabilities.
thank you.
Yeah, of course, that's a really key thing to remember. And it's also key to remember that every single person, every disability is different as well. We need to make sure that we are making ourselves accessible for every disability and, not just certain disabilities. So yeah, that's really key. So we've got another question. Do you think more needs to be done in education and at an education level to educate students about disabilities, whether that be physical or mental?
I think yes to that answer. I think it's definitely on the rise. The awareness I feel, has only started to become a bit bigger. I know that when I got diagnosed with it, I actually I didn't know where to go, because, for example, when I was in a lecture theatre, the hearing loop system wasn't working. So I eventually had to take a bit of a gap, 6 months, before I actually could return to university, so that reasonable adjustments and things could be put in place for myself. I think that has now changed. And we do need to be made more aware of what the disabilities are out there, and how we can help as individuals, even in our training and in our practice, how we can help our own patients. And it could be just as simple as, like you mentioned, like Anna mentioned before, can they actually hear us before we even start the consultation? Do they need any adjustments? So if someone's coming in a wheelchair, do we need a room that's got a little bit more space? It's very simple adjustments, but those simple adjustments can mean an absolute lifesaver for these patients and can make all the difference to them.
I think also making students that do have disabilities more aware of what they can claim the adjustments for, because, for instance, I didn't know I can even claim adjustments for chronic pain until they've realized, after I asked for multiple exceptional circumstances on my exams and assignments, where they reached out to me and said, "Oh, look, you can ask for this," which I didn't know. So I think that's quite important. And having the disability lead come, at least have a lecture, I don't know, in first year, and say, look, these are the things that you can claim the adjustments for, from that perspective. But then even with the education itself for the patients, I think incorporating more of these kind of consultations within things like OSCEs and CBAs, where we get to experience how it is to approach and lead a consultation with a patient that does have a disability.
Thank you, Anna. Anyone else? If not, I'll move on to the next question. This is a question for Naheem or Kamar. What kind of work is the PDA Pharmacy Support or RPS currently implemented to maybe accommodate disability in the workplace and university more? Like, is there any work being done?
Well, would you like to go first, or? Oh, sure. So I think what Kamal said before about the standing up for sitting down is actually really good, because actually for me, because I went to a talk at the pharmacy show in October, which Kamal was there as well. Actually, I didn't actually quite understand some of the issues that are, that affects, people with disabilities, and actually I'm starting to understand a bit more about it. And I think if I hear anything in the workplace about, people talking behind someone's back, I'm really going to challenge that from now on. So it for me, being in that discussion really opened my eyes about what's affecting pharmacists on the ground, how their disability is affecting, and just as I want to practice as well as I could, I don't think people should be held back. So I mean, personally myself, the PDA are starting to actually raise this at a profession-wide level, and get people who haven't got disabilities at least be an ally, and I think that's really important as well. RPS, very similar, similar discussions happening. They're the professional leadership body, so they can easily talk to politicians, and talk to them about some of the problems that pharmacists are facing. The RPS also ran a survey. For example, in the last survey, they found out that 43% that identified having a disability, 43% identified disability was like a biggest career barrier in pharmacy. And again, I wouldn't like to see, just as myself, I don't have a barrier, but I wouldn't like to see anyone else have a barrier just because they have a disability. The RPS also found out that 56% of the respondents in the survey believe that more should be done to support people with disabilities. So it's really about raising awareness, visible and non-visible disabilities in pharmacy. Like I said, start that profession-wide conversation and celebrate success stories. People, getting people to talk about their experiences in their own words, and highlighting, where there's good practice, not necessarily because we always talk about bad practice, but recognizing and celebrating good practice. Give a voice to common but underrepresented conditions and experiences, and support lifelong careers in pharmacy, to have the best people working. And I don't think having a disability should be a barrier for you to practice the best you can. So I hope that's okay. I don't have a disability, so I feel like I can't fully appreciate, but hopefully that answers some of the questions.
Yeah, that was really good. Thank you for sharing that. Kamar, do you have anything to share with us?
I think Naheem kind of hit the nail on the head with that. There is definitely a lot of support out there. So, and it's also not just the supporting networks, but it's also the team that you work with. And I think for me, I have now, well, and it is a journey, like I said, it's not, it might be that you have to go through a couple of bad jobs before you get a great job, or it might be that you get lucky and you get a great job to begin with. But it's also being able to voice it to everybody as well, that look, I actually do have this disability and I need help. just saying the word that I actually need help and I need a bit of support. And I have a great supportive team where they understand. So it might be that I need a bit of extra time, but that doesn't mean I can't do my consultations. It doesn't mean it could be you might suffer from, you might have certain mental health difficulties at times where you might need a break. I have that sometimes, and I'll take a bit of a breather before I do my next appointment. So it's just very simple things. And also a lot of the time, another adjustment that I tend to say is I lip read quite a lot. So a lot of my patients, I'm very good at face-to-face because I see them face-to-face. When I do anything online, we always try and make sure that we're in a space where, if I can't hear anybody, or I already have it preset, but I'll have like the captions turned on. And I think that awareness has started to increase, and it is becoming more prevalent. And I have noticed it a lot more since when I first began my journey in pharmacy. So there are lots of supports, and like I said before, the PDA Ability Network is great. It was the first time I spoke about it was at the pharmacy show, actually, which Naheem attended, about my own disability out there. Because again, I wouldn't want any pharmacy student, it's a hard slog. We're studying for 5 to 6 years, if not further, for the rest of our life. So, we need that support. And there are these great resources out there that can give us that.
Thank you
Thank you
so
so
much.
much for that. Sorry, don't mean to interrupt. No, that was amazing. And yeah, like I said before, it's so great that, for pharmacy students, trainee pharmacists and pharmacists alike, we have so many places that we can go if we feel like we do need help. So thank you so much for sharing some of those. So the next question is for Dominic. It says, firstly, thank you for sharing your experiences. What do you think the public opinion is on pharmacists and pharmacies nowadays, especially towards being accommodating to various disabilities?
I'm not sure about the public opinion with regard to that in general. It's not something that really becomes a topic of conversation much, I suppose, in my world. From a personal perspective, I would actually say that clinical environments, including pharmacies, are possibly some of the more accommodating public buildings with regard to my disability or wheelchair users. I mean, yes, there is room for improvement, but it's generally a societal wide thing, really, that unfortunately people with disabilities and people using wheelchairs are very much an afterthought often. And that's not something specific to pharmacies. That's a general thing, really. Pharmacies generally tend to be the places with the automatic doors, and with a little bit more space, and perhaps the better trained staff and the more accommodating staff than other retail environments or other places, really. So I haven't got anything bad to say about pharmacies in particular at all.
Okay, well, that's a good thing. That's a good sign. I mean, we can always do more, but it's a good sign that it's not the worst, but it could always be better. So yeah, thank you for sharing that. The next question is, what support groups are there available for pharmacists or pharmacy students with hidden disabilities or disabilities in general?
So I think I mentioned
We
earlier.
covered this a little bit.
Yeah, we have covered this a little bit, but I do remember. So when you're at university, another thing which I forgot to mention was, like Anna said, you can claim for things. So one of the things that I did was get extra time in all my exams. There's also, you can get like mentors, so you can have a personal mentor that helps you. You get equipment, so things like, and that all comes through your Dean of Students, which also offer things like counselling, so if you need a bit of support with your mental health as well. So I think in the university setting, you have got that, but you can also still reach out to things like, I think the RPS have certain resources available, as well as pharmacist support. When you get into the working world, it's not, I think one of the key things that we've got to remember is in the working world, pharmacist support, the PDA, everyone's there, but the first key thing is to make sure you get your grant and this is through the government, is make sure you fill out your access to work forms, because without them you're not going to be able to get any equipment, whereas at university it can just be given to you through the Dean of Students. So if it is something new or a new kind of disability that's coming about, or something that you've had for a long time, just make sure you go through those. But there are a lot of support groups, like we've said. So we said pharmacist support, we said the PDA Ability Network, which is definitely raising its campaigns. You've got the RPS there. So, and Listening Friends is really good as well. So there are definitely resources and groups out there that can support you. Hope that's all right.
Can I also add on as well, in university and in the workplace later on, occupational health is there as well to support us. So I didn't actually know about the access to work thing, because when occupational health has asked me about my disability, my workplace itself made those adjustments and gave me the equipment. So I didn't even have to ask. Actually, I told them I don't need anything, but then they kind of knew better than me. So they give me what I needed, and it turned out to be great. What else did I want to mention? So yeah, things like the disability leads, there should be one by each university. Things like getting a mentor. There's also an RPS mentoring scheme that I wanted to mention is quite good. Not just for disability, but generally throughout university and in the training year and later on. Yeah, and that's everything.
Thank you, Anna, for sharing that with us. I'll move on to our next question. Are there any support groups for people with learning disabilities, such as dyslexia?
I think we have touched on support groups. I'm not sure if anyone knows any about any that are dyslexia specific. Naheem?
I don't know if there's any dyslexia specific, but just to reiterate what we said before, RPS have got the ABCD group, and the PDA has got the Ability Network. So not specific to dyslexia, but I mean, I'm sure there's charities specific for people with dyslexia, but not necessarily for pharmacists or the general public. But I mean, you've got resources for both. So I mean, why not talk to both? I mean, that's what, you know. So you got your, you know, your general charity, but then you've also got pharmacy support as your professions charity. So, you know, I would say utilize both.
Thank you very much. Anybody else? No, then
That's
we'll
fine.
move on.
That was quite a specific question, and thank you for answering that, Naheem. I'll ask the next two questions are kind of similar, so I'll ask them together at the same time. So, has anybody had any bad experiences that have occurred in the workplace or university, and what was done to fix it? And if any bad experience have happened, what are the actions that you should take if something bad has happened to you?
I think it depends on what it is, first of all. So I can say though, when I'd maybe gone through a bit of a rough patch at work, or where, you know, sometimes like Anna just said, maybe your workplace knows what you actually need. So I was at a point with my disability where I actually didn't know what else I needed or what else was available, because it was so new to me. So I didn't know, for example, that I could get certain microphones that would help me if I was in a dispensary setting. So this was all new for me. But the places that you can go to then is, obviously, you can get in touch with your PDA. So PDA have got multiple different resources there. So even if it was something that where you've ended up having to maybe have a fitness to work kind of meeting that's happened, or it's ended up it's gone a bit further down the line, then, you know, the PDA have always been there to support me, and they're there for that reason as well. They are your advocacy to go to when you're in the workplace. I don't know about any other people that I've gone to, if it's gone quite further, but they do support you. So I mean, and they've got plenty of like lawyers in there, so they know exactly your rights and what you're entitled to. So it's anything you're unsure about, you can definitely go to the PDA regarding that.
Yeah. Yeah, Naheem.
I'd just like to talk about, sorry, if I could say, if no one else is going to, talk. In terms of bad experience, I remember having knee surgery done in 2015 and going into a pharmacy, and I told them specifically, I want an uninterrupted break. Do not bother me, and I'm going to go sit down in the consultation room. And I say that a few times, and it just got completely disregarded. And I was furious, and I went to the area manager and just complained and complained and complained. But I mean, I personally think that, someone had an ongoing condition, where they needed to, have a proper break. I just think that actually, why is it that you seem like the pharmacist needs to be there at all time and needs to be? I don't think that's completely correct, and I just think that just from my experience, I'm not disabled and my knee's much better now. But I just found that I think there's something that is, I don't know if it's traditional, but it's expected that all pharmacists need to stand up when they're checking, which I don't think is correct. And I think there's just these perceived biases, is that the right word? Just these traditions where this is how a pharmacist is expected to behave when they are working, and it's just completely unreasonable. It's like someone just thought about this a long time ago and just thinks that this needs to continue to this day, which I just think is completely not on. So I don't know if that helps, but I just remembered that experience. I was not happy.
Yes, Anna.
I wanted to mention during placement, I know of many stories of people fainting. So simple things like asking for a chair, either at a ward or in a community pharmacy. How Naheem said that somehow it has become a thing that we need to stand all the time. And some people just need a chair. I don't see how that is such a big deal. So to me, it happened that I wasn't allowed to sit. And I just went and explained why I need this. And then the same with the placement lead. If you have any issues at the placement, speak with the lead. What else? Yeah, during the workplace university. Even things like during exams, asking for those adjustments, and if they have not been granted, put in a complaint. Yeah.
Thank you so much for sharing your experiences. We'll move on to the next question. This is a question for Anna. How did you cope with chronic pain in university and during your pre-reg year? Do you know of any ways that we could ask for help, and what can we use for them often? Like, is there any available help for us to use, and how often can we use them?
So with chronic pain in university, with me, it's not just the pain itself, but other symptoms that come from fibromyalgia. So I had extra time. I was allowed a toilet break. And then during my pre-reg now as well, I get my workstation and dispensary adjusted to me. So I get a chair. They even adjust it, and then sometimes they would write your name and then nobody else can adjust it. At the ward, I just sort of grab whichever chair I can get, but they also gave me a stand and a mouse and a keyboard. I think it's really just about asking for what you need. And if you don't get it, ask again. And coping with the chronic pain itself, trying not to overexert yourself because you think, oh, I'm fine now. But then later on you realize you've done too much and now you're in pain. And then knowing and trying to say no when you can't deliver something as they're expecting of you, and not feeling bad about it. Yeah, that's all.
Thank you so much for that. Sorry, I don't want to interrupt you. Thank you so much for sharing that, Anna. Moving on to the next question. As people or professionals who have a disability, do you have any coping mechanisms for when you're feeling down?
I think throughout like my pharmacy kind of as a pharmacist kind of journey, it's thinking about like what works for you. So different things that might cause you stress or whatever that is. It could be that you've done CBT counseling and you've learned some things. So something that I learned if I was in like a really panicky situation is just the simple butterfly, helping to calm myself down. It could be that you've taken up a different sport, you've got different ways of letting that stress out. It could be that you do, and nowadays there's a lot of mindfulness programs that are available. And sometimes it's doing things outside of pharmacy. And I think we've got to really hone that in because as pharmacists, we feel like we are constantly working 24/7, that there never is a break, or we can never get away from it. And it's about learning to have that balance that actually, you've done your bit, but there's other things that are important in your life as well. And make them a priority as well. So then you won't get burnt out. So they're just a couple of things that I've probably done or techniques. It's very individual based, I think, and very personal as to like what type of stress you might have or what type of whatever it is. But I mean, if anybody else has any other ideas, I mean, some people go straight to like listening friends, or if they've had a really bad day at work or it's been very difficult, there could be a lead. You might have a mentor, you might have a lead or a superior that you're comfortable speaking to about it. So yeah, there's definitely support there. It's like I think what we're really honing in is just to ask, keep on asking, keep on explaining what the difficulties are that you're having, and to actually accept that it's okay. It's okay to sometimes not be okay. And it's okay to feel sad at times because we're not perfect. Nobody is perfect. And you are going to have up days and you're going to have down days as well. But there are ways of getting through them.
Yeah, that's so true. Thank you so much for sharing that. Somebody's put in the comments as well that about what we were saying about before. It's crazy that there's still a stigma around sitting down, being unprofessional. And I think that's so true. I see so much discourse about this as well. And I think it's crazy that still in this day and age, we still assume things about people. Oh, Anna, you got your hand up?
I wanted to add as well for when feeling down. There's so many different CBTs that can be used based on the condition. So I actually found it on the NHS website. I think the website is great. Any condition that you put, it lists as well how to help with mentally, because a lot of these disabilities and condition do make you more at a risk of developing mental health illnesses as well. As with the mechanisms, taking time off. And then as people who deal with disability as well, there's a lot of networks that patients can join. And even speaking to people with the same disability just makes you feel better and more understood. And you can see ways of how they cope as well.
you for that. It's really opened my eyes actually that CBT can be used in so many different ways as well. And that's actually something that I've learned today is that it can be used for more than I initially just thought it was. So thank you for sharing that. Sanjita, if you'd like to ask the next question.
Yes. This is for everyone. Do you think the care for disability differs in a hospital, GP pharmacy, community pharmacy, or universities?
Or is it good overall? Is it bad overall? I mean, I know Dom, you kind of hinted before that it might be better than, other
Yeah.
places.
Yeah, that's right. I mean, I haven't noticed. I mean, obviously, I can't speak for universities, but I haven't really noticed any difference between going to a hospital or a GP surgery or a pharmacy. I suppose perhaps the only difference in GP surgeries, sometimes they're not so well thought out, they're not so well put together. But the attitude, yeah, maybe in my experience, it's been a bit worse in GP surgeries than pharmacies and hospitals. Maybe, but it's my limited experience. So
I mean, I do agree with that. I know my local GP that I've been with for 11 years, they didn't have a lift until I would say like in the last 5 years. So that was something that now that I'm learning a lot more as a pharmacy student, it's so shocking to me that it took them, I don't even know how long. It's very recent in the last 5 years that they decide to get a lift for people. So I think there's a lot more that we can do. What about you, the rest of you guys? Do you have anything to say about this? Okay, well, yeah, I know.
I wanted to say, I feel like it can differ between these different sectors based on how much time we have with the patient. So, for instance, the other day I saw a lady in a hospital that actually got admitted because she couldn't use her inhaler, the brown inhaler. So she wasn't having any regular medication because she couldn't use it, but nobody asked her. So in the hospital, we had the time to switch her to a different inhaler, but this is not a case everywhere. And with the GP as well, I think there should be more regular reviews because people's conditions and disabilities can oftentimes change as well. And in community, I do find it sometimes that we don't have that time to give to a patient to actually care and see if they're compliant with all their medicines. And even giving them advice how to better use their medicines would be so much nicer if we just had a bit more time.
Thank you for sharing that. We'll move on to our next question. Molly, do you want to ask that?
Sure. This is for everybody in general. We've kind of touched a little bit on this, but they've asked, what would an ideal pharmacy look like for easy accessibility for patients with a disability? And then they said in brackets, obviously every disability is different, which is a good point to make. We kind of touched on this a little bit with the height of the desks, but I'm not sure if anybody has anything that they'd like to add to that.
I mean, this isn't necessarily specific to pharmacists, but chemists in general, like big branches of Boots and stuff, a bit more space, less stuff, let's say. I mean, that's retail, I suppose. They want to sell as much stuff as possible and have as much stuff out. But if there was just more space, really.
I don't know whether there's I'm not sure whether it's out there yet, but I know some pharmacies or even GP surgeries do have the sign for like the hearing aid users or loop is available. They're making sure they're visible or having, for example, letting people know that they do have a consultation room available for people to come and sit in, that their conversations are going to be private, or whether, if someone does have chronic pain and they need to, there's space for them. There's somewhere for them to go and sit down and have that conversation. I'm just trying to think. Yeah, there is a lot more that can be done as well, I'd say. But it's all work in progress, and it all comes from people like ourselves who've gone through it, or even speaking to patients as well, like how else we can improve. Maybe the layout of pharmacies might have to be a bit different. Like we mentioned with this, the height of the counters. Some might have to be pet friendly as well. So if you've got anybody who's like blind, being able to allow them to bring their pets in if they've got a guide dog with them. Just certain things that might have to be put in place to ensure that it is disability friendly, I suppose.
No, that's very important. I remember hearing a story about a wheelchair user at my university who couldn't get in the door to placement. So she wasn't able to complete her placement day because she wasn't able to access the building. So yeah, really key things to take away from that discussion. So thank you guys for sharing that. Sanjita, if you'd like to ask the next question.
Yes. How can you help someone who has come to you as a listening friend or wanting to speak to you regarding their disability?
Sorry, I didn't quite catch it. Was it about how to contact a listening friend?
No, it's okay. So basically, the person is asking, how can you help someone who's come to you as a listening friend? Like, so they're coming to you with their disability. How can you help them?
I think it might be based, so it depends on what the disability is, first of all. And if you have got any first-hand experience of it, then you can give your own personal experience. However, it could also be a case of where, you can signpost them to certain resources that you're aware of or certain groups that you know of. And it also might just be yourself, you have to be that active listener. You just have to be there for that moment in time. And sometimes that is all that individual patients need. They just need someone there to listen to what they're currently going through, which is something that we all kind of overlook at times. We don't realize how much people just need to talk. They just want to talk and they want to let it out, and then maybe they don't have an outlet or a way of doing that. I think I'm just trying to think what else I might have done. And just keeping an open mind, I'd say. Being friendly, being open-minded, knowing, and if if you don't know of places, maybe if you know of someone who has suffered from some sort of disability that you can get them in touch with. I think yeah, I think there are definitely things out there, but it's just keeping that open mind and being able to just be there and listen to them as well, provide them that moral support that they need at that time. I'll pass it on to Anna.
Yeah, just to reiterate what Kamar said, to start out a conversation, ask them what do they need, because I think as pharmacists we often, especially if it's in community and we get a patient, asking them whether they want advice or they just want to be listened to, or how we can help, because people don't always come to you for advice. Sometimes, as we mentioned, it's just to listen to them. People with disabilities as well, sometimes they could live home alone, and a community is a good place to come and just ask for some help and advice and a listening ear, I guess. Yeah.
Thank you for that. We got someone in the comments saying, thank you all for all of your answers and opening up about your experiences. This has been very insightful. And I think that about summarizes it. It's been great. Thank you all for joining. We're gonna close out our panel discussion now. But thank you all so much for engaging and asking lots and lots of questions. It's been really nice to have this conversation, and we're just going to close the webinar by talking about some events that we've got upcoming. So I'm just going to share my screen again with you guys, if that's okay. So if any of you guys are located in the Eastern area, we have an upcoming conference at the University of Leicester on the 14th of December, and it's covering women's health. The title is Women's Health Uncovered, the Essential Guide to Women's Health and Wellbeing. It sounds really, really interesting. Hopefully, this will be another event where we're able to break down some barriers and debunk some myths. So if anybody is interested, the QR code is there. And I am going to pass on to our annual conference organizer, Harvey, to just talk about our upcoming annual conference, which is taking place in April. Harvey, if you'd like to come on the mic.
Hello, can everyone hear me?
Yes.
Yeah, we can hear you.
Excellent, lovely. Probably you guys have already heard from me before. Just a quick introduction. I'm Harvey. I'm one of the annual conference organisers, and probably by now you already know that that the annual conference is being held in Swansea. And if you don't know about this, where have you been for the last couple of months? But as we've been talking from virtually from the start of this academic year, the annual conference is the flagship event for the BPSA, and it is one of the most important and arguably most people's favourite event when it comes with BPSA. So this is a week-long conference which has been held in my university and the other annual conference organizer, Martina. This has been held in our home university of Swansea, and also my hometown. So I'm really looking forward to inviting everyone, every single member of the BPSA to come to Swansea. So what sort of things are you looking forward to? So there's international night, there's lots of themed nights. We've also got an awards night, which is held on the Wednesday. You've also got BPSA Day, which is a whole day just for networking opportunities. It isn't just about pharmacy. There's also, it's a fantastic way to make new lifelong friends. And for some of these people that are on the call and who are on the committee, I've made friends from my first AC, and they've been some of my closest friends that I've ever made. But with Swansea itself and the university, it is right on the seafront, right from the bottom right-hand picture. It is literally a stone's throw away from the sea, and it is just a lovely, it's a lovely city to be in. So yeah, I'm just really looking forward to bringing you all here. And again, if you've got any questions regarding AC, because tickets are being sent to the schools of pharmacy as we speak. So if you do want to come, message your school of pharmacy or your head of year or your head of school and ask about getting access to those tickets, because some universities do fund them, and to get that funding you do need to ask. But if you do need any help or anything, you can contact myself or Martina through your reps and liaison. But yeah, and I'm not going to take up too much of your time. I'm just thank you very much for that very, very short section. Thank you.
It's okay. Thank you so much for sharing that. We're all very excited for annual conference this year, so can't wait. Hopefully see some of you guys there. So that's actually brought us now to the end of our webinar. I'd like to thank each and every one of you for attending. It's been really insightful, really inspiring, and I'm sure that there's something that we can all take away from this webinar. And I would also like to reach out another thank you to all of our speakers for attending tonight. It's been really kind of you to give up your evening and come and talk to us and answer all of our questions. So thank you so much. And if you guys have any further questions, feel free to reach out. We are via Instagram, email. You can see all our socials are down here at the bottom of the screen. So please feel free to reach out if you have any more questions. And hopefully we'll see you at the next one.
Thank you, everyone.